Hello, welcome back to Small Hearts, Loud Voices. A very, very warm welcome to all of you out there. My name is Adrian Adair, founder of Heartbeat Forward, and this is the podcast dedicated to making congenital heart disease impossible to ignore. So let's do a recap. We have talked about the number 1 in 100. We've talked about tetralogy of Fallot, 4 defects, 1 heart, 1 child. We have sat in the waiting room with the families who knew what it means to hand your child to a surgeon and walk away. Now today we're gonna go somewhere that requires everything we have. Today we talk about one of the most severe, most complex, most misunderstood congenital heart conditions in existence. A condition where a child is born with half a working heart. Today we talk about Hypoplastic Left Heart Syndrome. Okay, so let's get into it. Hypoplastic Left Heart Syndrome, HLHS. It is 4 words that carry the weight of the world for the families who receive this diagnosis. Here's what it means. So the human heart has 4 chambers, 2 on the right side, 2 on the left. In a healthy heart, the left side does the heaviest work. It receives oxygen-rich blood from the lungs and pumps it out the entire body. It is the engine at the center of everything. In a child born with hypoplastic left heart syndrome, that engine is severely underdeveloped. The left ventricle, the mitral valve, and the aortic valve, and the aorta itself are all critically small, sometimes barely formed at all. The left side of the heart cannot do what it was built to do. In some cases, it can't do anything at all. So without intervention, hypoplastic left heart syndrome is fatal within the first days of life. Okay, let that land. Not weeks, not months, days. For decades, HLHS was considered incompatible with life. There was no treatment, there was no surgical option. Families were told to go home and hold their baby and say goodbye. But that changed in the 1980s when a surgeon named William Norwood developed a series of 3-stage surgeries, now known as the Norwood procedure, the Glenn procedure, and the Fontan procedure. These 3 surgeries performed in the first months and years of life reconstruct the heart to function on a single ventricle. The right side of the heart is rerouted to do the work of both sides. It's not a cure. There is no cure for HLHS. It's a reconstruction, a reimagining of what a heart can do when it's given the chance to try. Children who complete all 3 stages of surgery go on to live lives that their parents were once told were impossible. They go to school, they make friends, they laugh and run, and grow and dream. But the road to get there is one of the hardest roads any families will ever walk. HLHS affects approximately 1,000 babies born in the United States every single year. It accounts for approximately 2 to 3% of all congenital heart disease cases, and it remains one of the most medically complex conditions in all of pediatric cardiology. These children are here because someone fought for them, and they deserve a world that knows their name. Okay, so I want you to imagine a mother at her 20-week ultrasound. She is alone because her partner is at work and they both agreed this was just a routine appointment. She is looking at the ceiling and listening to the technician describe what she is seeing on the screen. And then the technician goes quiet in a way that is different from the pauses before it. She is referred to a specialist the same day. By the end of the week, she has a diagnosis: Hypoplastic Left Heart Syndrome. Her baby, the one she has been talking to through her stomach for 5 months, the one whose name she has already chosen, is going to be born with half a working heart. She is told about the 3 surgeries, she is told about the risk, she is told about the outcomes. She is handed pamphlets she cannot read yet because the words keep blurring. And she is told that her baby, if she chooses to continue the pregnancy and pursue surgical intervention, will spend the first months of her life in a cardiac intensive care unit. That the first surgery will happen within days of birth, that every milestone other parents take for granted, the first smile, the first word, the first step, will happen in the shadow of a medical journey that will never fully end. She goes home. She sits in the room. She has already started decorating, the one with the soft yellow walls and the small white crib, and she makes a decision. She chooses to fight. Her daughter is 4 years old now. She has completed all 3 stages of surgery. She has a scar that runs the length of her chest and a laugh that fills every room she walks into. She has a favorite color, which is purple, and a favorite song, which she sings at the top of her lungs with absolute no regard for the correct lyrics. She is here, against every odd, against every statistic, against every quiet moment of doubt her mother sat with in that yellow room. She is here because her mother chose to fight, and because surgeons chose to believe that half a heart was enough to build a life around. And it was. If you are a parent who has received an HLHS diagnosis, I need you to hear this. What you are feeling right now is not weakness. It is not failure. It is not a sign that you are not strong enough for this. It is the natural, human, completely valid response to being handed the hardest news a parent can receive. You are allowed to fall apart. You are allowed to grieve. You are allowed to sit in that yellow room or that hospital chair or that parking lot and cry until there's nothing left. And then you're allowed to get back up. Because here's what I know about the parents of HLHS children. They are some of the most extraordinary human beings walking this earth. Not because they are superhuman, but because they show up every single day for a child who needs them in ways that most people will never understand. They learn a medical language that was never meant for them. They advocate in rooms where they feel invisible. They fight when they are exhausted and love when they are terrified and keep going when every part of them wants to stop. That is who you are, even if you can't feel it yet. And to the HLHS survivors, the ones who are old enough to understand their own story, the ones who carried 3 surgical scars and a heart that was rebuilt just for them, you are not half of anything. You are whole. You are extraordinary. You are proof that the human heart, even when it arrives broken, has a capacity for life that defies every expectation placed upon it. Half a heart, twice the fight, and a life that is entirely, completely, magnificently yours. Okay, so here's what I'm asking you to do today. Say HLHS out loud. Hypoplastic Left Heart Syndrome. Learn it, remember it, because the families living with this diagnosis have had to say it in their hardest moments of their lives, and the least we can do is know what it means. Then share this episode with someone who needs to hear it, a parent who just received this diagnosis, a family member who does not yet understand what their loved ones are going through, a friend who wants to help but doesn't know where to start. Knowledge is the beginning of advocacy, and advocacy is what changes the world for these children. Visit heartbeatforward.org to learn more about our mission, our care packages for children in cardiac units, and how you can support HLHS families and the broader CHD community. And if this episode meant something to you, please leave a review and share their show. Every living listener is another voice added to this mission. And thank you so much for being here for episode 4. To every HLHS family who has walked the hardest road and kept going anywhere, this one was for you. This is Small Hearts, Loud Voices. My name's Adrian Adair, because every small heart deserves a loud voice.